Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Alison Bergeron, a family nurse practitioner at Terrebonne General Health System. She's going to be telling us more about her role at the Terrebonne General Multispecialty Clinic in Gray and what services she brings to the community. Welcome to the show, Allie.
Hi, thank you. I'm very excited to be here.
All right, well, let's get started with you telling us a little bit more about yourself and your role at the multi-specialty clinic.
Sure. So I have been a nurse practitioner for, it's going to be 10 years. I'm from Homa, born and raised here, wanted to stay in the local community, married, 2 children, and I'm going to be there full-time Monday through Friday at the clinic in Gray.
Wonderful. So tell us about, when did you first decide you wanted to be in the medical field?
Shockingly enough, my kindergarten, one of my projects, I wanted to be a nurse. So one of my bigger cousins was, and that's where we started, I guess.
Okay, and why did you decide on family medicine?
So I had done specialties in the past, and the thing is that I wanted to be able to look at patients and not have to say, oh, you need to go see somebody else to handle that. I like to take care of the patient as a whole and then send them to a specialty, if further investigation or help is needed.
Okay, and as a family nurse practitioner, how will you serve patients at the Gray Clinic?
So yes, there's multiple different ways that we can do wellness, and preventive medicine is one very large component of it, as well as school physicals, wellness exams, if they're ill, chronic illnesses, acute illnesses, immunizations, pretty much any aspect, you name it, we can pretty much help.
Okay, so all those types of medical services will be available
Correct.
at the clinic.
Yes.
Tell us more about the wellness and preventative services that you offer.
Sure. So, wellness and preventive medicine is one of my passions. I truly like to dig deeper into the overall inflammatory markers because that's the start of disease, as well as looking at cholesterol and going a little bit further into what size particles, what actually pulls things into the vessels to make plaque. So, it kind of gives us a better way to be proactive instead of reactive when it comes to diseases and medications and, kind of take a little integrative approach instead of just doing medicine all the time. And, always people say, oh, I get another pill for something. No, let's look at ways we can kind of help and do things to prevent before we even get to that disease.
Right. And as a nurse practitioner, how do you work with the physicians?
Sure. So nurse practitioners, we collaborate with physicians. So what that means is that, which is great because I really have great relationships with all of them, including the specialist. So, I do have experience in regards to cardiology, emergency medicine, family medicine, but it's always great to be able to, pick up the phone or walk to another office and just be able to collaborate with them and ask if it's a very complicated patient to get their input.
And why is the clinic so beneficial to the community?
Well, Terrebonne Parish is very widespread in the community that we serve here. And so to have a more localized, smaller, but impactful clinic that has specialties as well, we're able to really draw in and make it easier for our patients from further rural areas to get the care that they need.
Right, and that location is just so convenient. I mean, right off the highway and
It is
everything.
right off of Highway 90. It's really accessible to a lot of areas.
Okay, and so what excites you most about, restarting your career here at this
Yeah.
clinic?
Well, I love, first of all, being back at Terrebonne, the staff that we have, the nurses that we have at this clinic. I really can't commend them enough for their work and their dedication to it. But what excites me the most is being able to be where I'm from, serve the community, and help us hopefully be a healthier community as a whole.
Right, and don't you have specialty services available at the
Oh,
clinic?
yeah. So we have multiple specialties that are there with more coming this summer. But so far we have endocrinology, pulmonology, internal medicine, and like I said, with more coming this summer.
Okay, exciting. And are you accepting new patients?
Of course. Yes, definitely accepting new patients.
All right, and how does a patient go about getting in
Yeah,
touch?
so
Or
it's
how does
really easy. So they can actually, we do take walk-ins, but of course we prefer if people could call so we don't have people waiting. The allotment for every patient, we want to be able to give them the attention that they need in that time, but they can call the clinic. That's the easiest way, or, call the hospital and they can give them our number if they would want to know, or just simply walk in.
Okay. All right. Well, let's talk a little bit more. You did mention a lot of the services. Can you just kind of tell us a little bit more about some of those specialty services and other things that are available?
Yeah, so we do have, like I said, endocrinology that comes, and she also specializes in some weight loss as well. And then pulmonology, we have, they are intensivists in the ICU. They really bring a lot of experience to the team, as well as internal medicine. So, internal medicine is really great for those chronic diseases, and we all collaborate very well together to take care of the patients.
Good. And I know we're the electronic medical record system that's available too.
Yes, that makes
Tell,
it so easy. It really does. Having electronic medical records allow us to be able to see care everywhere, and that's actually what it's called, care everywhere. And we can actually, see what's been going on, get records easier in a timely fashion.
right, and that's my chart, correct?
Correct. Oh, in my chart, yes, it allows the patients to actually see their own chart and their results as well.
Right. Are tests also performed at the clinic?
We do have point of care testing that we can do. We will have lab services and x-ray in the future. But at this time, sometimes we do have to still send them to the main hospital, get things done, but we're definitely trying to make it as convenient as possible to have all those services.
Okay, one-stop shop,
Yes,
right?
definitely.
All right. Well, how can people schedule an appointment with you?
They can call, I think it's 873-GRAY with an A, is the number to our clinic, and we are open Monday through Friday, 8:30 to 4:30. They can walk in, but we prefer that they call just to make sure that we have the time allotted for them.
Okay, sounds great.
Yes.
Well, thank you so much for your time today and
Yes.
joining us.
Thank you so much. I appreciate the invite.
Welcome aboard.
Thank you.
For more information about the Terrebonne General Multispecialty Clinic, visit tghealthsystem.com. I'm your host, Rhonda Alford. Thanks so much for joining us on To Your Health, and I'll see you right back here next week.